All right. Hi, everybody. My name is Tom McBride. I'm one of the core faculty members as part of the Family Medicine residency program.
And I'm Nishiike. I'm a nurse practitioner and one of the deputy CMOs for Lifelong Medical. And we are co-directors of curriculum directors for the Family Medicine Outpatient Rotation.
Yes, so we're super excited to tell you about this rotation and how it kind of changed over the course of the last year, and how we as a residency program were really able to respond to those changes. So really there's kind of four cornerstones that we envisioned would be the foundation for this rotation. Practice management, number one, and being able to actually teach residents over the course of their training how to be effective primary care clinicians, how to use things like panel management and their electronic medical records to really deliver effective primary care. Number two is quality improvement. So we as an organization have really valued how quality improvement impacts our ability to deliver high quality primary care. And we want to bring that into the way that we train residents as well. The third is team-based care. So actually, training our residents to work effectively in clinical teams over the course of their training. One big example of that was the Getting to the Heart curriculum, which is developed by clinicians and medical assistants in the East Bay as a strategy to break down some of the power dynamics between medical assistants and providers and to build effective communication and effective teams between those dyads. And then lastly, patient advocacy and leadership. So we really want our residents to identify their passions over the course of their residency and be able to explore those through not only the work that they do in clinic with patients, but also the broader work in the community and advocacy, taking on leadership roles that allow them to really explore and express those passions.
So nothing really was normal in 2020, and the family medicine outpatient rotation was no different. We had lots of constraints going into the other rotations and starting the year, and really a lot of uncertainty, and decided to combine all the residents to do the 4-week rotation, FMOP rotation in the beginning of the year as kind of the transition to residency segment. And it really turned out to be a blessing in disguise, in that we were able to do all of these activities together as a team and really kicked off the year to a good start. First, the Telehealth Orientation. We're sort of learning as an organization on how to do this well, but just to keep the access for the patients and the financial health for the organization. This was such an important part for the residents to really understand quickly and to run with it. They were also able to engage with lots of COVID-specific clinical experiences. So we have a COVID provider team that really knows the most up-to-date COVID information and doing lots of consultations in that, and they were able to engage with that. They were also going out to with the street medicine team for providing primary care to patients who are experiencing homelessness, which is such a important piece of the pandemic response. Patient safety and staff safety from the lens of infection control. So this is such an interesting thing that really, I've never thought that I would learn about PPE as much as I did this year. Quality improvement series, which was a didactic series, an hour a week, where we really pushed through and learned about how a good QI project kind of goes through, and doing this together and coming up with project starts was such a great start to a program, and I think the momentum is still going. We also did a 4-week series called the Lifelong in the Pandemic series, which was really, engagement and exposure to lifelong leadership. We got key members of the leadership of Lifelong to come to some panel discussions, and we were able to ask questions and really discuss how Lifelong as an organization responded to the pandemic. So, a really great opportunity to get face-to-face with what healthcare leadership administration and leadership, what the heck they're doing, and perhaps find some passions through that, hopefully some passions through that. So off to a good start.
Yeah, so we don't know what 2021 has to bring, but we definitely know that we will be responding to that and engaging residents in the way that our organization is responding. So come join the team. Thanks.